Today's Supreme Court ruling means millions of Americans can still get tax credits to buy health insurance.
Even if they live in a state like Wisconsin that never set up its own marketplace. So who's using Obamacare and how much money are they getting? Those are good questions for Heather Brown.
Across the country, there remain people who are directly benefiting from the law, but don't even know it.
More than 16 million people have gotten health insurance through the Affordable Care Act, a big chunk of them through expanded access to Medicaid, and about 10 million through the individual marketplace.
Is there an average person using Obamacare?
It spans everything.
Steve Parente teaches healthcare finance at the U.
It spans kids that might have come off their parents' plans after the age of 26.
I have type 1 diabetes. I cannot not have insurance.
It spans somebody who's chronically ill, who's before they're the age of Medicare. It really is all over the map.
Makes me feel scared not having insurance.
And then the other folks are folks that could not afford insurance previously.
A recent Gallup poll found 88% are now covered. That's up from 82% in 2013.
Right now, that number would be about 34 million people in the U.S. don't have health insurance.
Do you see that changing?
It'll go down a little bit more, and then it's going to bottom out.
Today's Supreme Court decision centered on subsidies. Of the 10 million who've signed up for Obamacare, 85% get tax credits. The average amount, $272 a month.
On average, it's probably about 50 to 60% of the premium. It can be as much as 90% of the premium. It can be as little as 10% of the premium.
And that depends on how much money the person makes?
How much you earn.
In Minnesota, about half of the 50,000 people with individual MNsure plans get financial help. It averages $161 a month. Our premium costs are lower here, and more of the working poor have access to insurance through other state programs.
You see, a lot of people get Obamacare, but it's really a very small percentage.
That's right.
Of the population.
Correct. It's less than 10%. The average voter actually is pretty much untouched by Obamacare.
Professor Parente told Heather if you measure the success of Obamacare by how many new people have gotten health insurance, then it worked. But he also said we don't yet know the full cost of the program.